Welcome back to the Striving for Better Life channel. Are you concerned about your heart health and looking to achieve normal cholesterol levels? This comprehensive guide gives you 7 powerful tips to quickly reach and maintain normal cholesterol levels. Using these proven strategies, its premise is you can take charge of your health and live a heart-healthy life. Learn how simple lifestyle modifications and dietary changes can have a big impact on your cholesterol levels. Implement these techniques today and embrace your health. This episode will be divided into several parts, including: what is cholesterol? What is the difference between HDL cholesterol versus LDL cholesterol? What are the symptoms of high cholesterol? What are healthy cholesterol levels, natural treatments for high cholesterol, and precautions? Cholesterol levels, and other matters related to our topic today. Let's get started. Cardiovascular disease, CVD, is a major cause of morbidity and mortality in the United States, with approximately 1 in 3 Americans dying from heart disease or stroke. According to the CDC, high cholesterol is a major risk factor for cardiovascular disease, and some treatments have been strongly associated with a reduced risk of atherosclerotic cardiovascular disease. Statin use increases with age, from 17% of adults aged 40 to 59 years to nearly 50% of adults aged 75 years or older. In other words, it's important to maintain normal cholesterol levels because high cholesterol is a sign that something is wrong, or could go very wrong in the future. These risks double when you also have high triglycerides. Together, these are referred to as hyperlipidemia. Sometimes, it is important to lower cholesterol naturally. Let's reveal the truth. What is cholesterol? Does it really have to be as low as you've been told? Are there different types of cholesterol? How do you get normal cholesterol levels? And what are normal cholesterol levels in the first place? Part 1. What is cholesterol? Cholesterol is a waxy, fat-like substance found in all cells in the body and in some foods. It is an essential substance for the synthesis of vitamin D, some hormones, and bile salts that break down carbohydrates, fats, and proteins. Your brain also needs cholesterol because it helps produce neurotransmitters like serotonin and dopamine. Foods high in cholesterol range from very healthy to incredibly unhealthy options, from eggs and dark chocolate to potato chips and cookies. The 5 items consumed in the United States that contain the highest levels of dietary cholesterol include eggs, chicken, beef, hamburgers, and cheese. For a while, it was widely believed that eggs were bad for your heart because they contain a lot of cholesterol. 24.6% of eggs are cholesterol, to be exact, and would increase your blood cholesterol, the amount of this substance in your blood. However, it appears that dietary cholesterol is not as harmful to your health as it initially seemed. For example, eating eggs long-term does not actually increase markers of heart disease, including blood cholesterol. Blood cholesterol numbers are important because high cholesterol levels build up in the arteries, forming plaques that lead to atherosclerosis, a form of heart disease. The second part. The difference between HDL cholesterol and LDL cholesterol. As more research is done, healthcare professionals realize that even within the 2 common cholesterol distinctions, there are many differences. At the most basic level, there are 2 types of cholesterol circulating in the body: LDL cholesterol and HDL cholesterol. Many people think that low-density lipoprotein, LDL, is bad cholesterol, but that's not really a fair assessment. It's all cholesterol, and these proteins carry fats to and from cells. They're just different sizes. What is HDL cholesterol? HDL stands for high-density lipoprotein, which means that HDL particles are larger than LDL particles. HDL cholesterol transports cholesterol molecules from the body's tissues to the liver, where they can be reused or removed. LDL is low-density lipoprotein, cholesterol, and must be kept in a specific ratio to HDL particles to keep the risk of heart disease low. There is a third type of cholesterol that is not tested for in regular cholesterol tests, but is estimated based on your triglyceride level, VLDL cholesterol, or very low-density lipoprotein cholesterol. VLDL contains 70% triglycerides by volume, while LDL, or HDL, contains much less. VLDL cholesterol is what transports most of the triglycerides throughout the bloodstream, and high levels of these two molecules are the main cause of plaque buildup in the arteries. Part 4. Symptoms of high cholesterol. So what is high cholesterol? Can you feel this happening? According to the U.S. National Library of Medicine, there are no known symptoms of high cholesterol. The reason high cholesterol is considered a problem is not because of any outward symptoms, but because some research suggests that it may increase the risk of heart disease if it remains high over several years. For most people, maintaining normal cholesterol levels is a matter of diet and lifestyle. One study showed how lowering your cholesterol with medications to incredibly low levels didn't seem to actually affect the incidence of or death from coronary heart disease. Emphasis should be placed on achieving good levels of different cholesterol levels and practicing a diet and lifestyle that gives the body the best overall chance for health. What causes high cholesterol? This is more likely to happen if you eat a diet high in omega-6 but low in omega-3, which leads to inflammation, processed foods, lots of refined grains, and excess sugar. Smoking, obesity, and a sedentary lifestyle also contribute to high cholesterol. Fifth part. Healthy cholesterol levels. So what are healthy cholesterol numbers? What are the best cholesterol levels? HDL to LDL cholesterol ratio. Monitor your HDL to LDL cholesterol ratio by making sure you have a ratio of 1 HDL molecule for every 2.5 LDL molecules, 1 minute and 2.5 seconds. A ratio of 1 to 6 or higher indicates that your blood cholesterol is not at the desired level, while a ratio of 110 or higher is considered seriously unhealthy. To calculate this, multiply your HDL number by 2.5. If the result is the same as or higher than your LDL cholesterol number, it is in a good range. Triglycerides to HDL cholesterol. When you break down triglycerides into high-density lipoprotein, HDL, cholesterol, it can help detect a higher risk of heart disease. This may be due to the fact that your triglyceride numbers are directly related to the amount of VLDL cholesterol you currently have. If this number is higher than 0.022%, it is time to work on getting back to normal cholesterol levels and normal triglyceride levels because you have hyperlipidemia. What is hyperlipidemia? This means that your triglycerides and cholesterol are too high. Meanwhile, normal cholesterol levels are as you can see in the following tables. Total cholesterol. Total cholesterol levels. Less than 200 mg/dl. Desirable. 200 to 239 mg/dl. High level at the border. 240 mg per deciliter and above. High. LDL cholesterol. LDL cholesterol levels. Less than 70 mg/dl. Ideal for people at risk of heart disease. Less than 100 mg/dl. Ideal for people at risk of heart disease. 100 to 129 mg/dl. Close to ideal level. 130 to 159 mg/dl. High level at the border. 160 to 189 mg/dl. High. 190 mg/dl and above. Very high. HDL cholesterol. HDL cholesterol levels. Less than 40 mg/dl for men. Also, if it is less than 50 mg/dl for women. Weak. 50 to 59 mg/dl. Better. 60 mg per deciliter and above. The best. Triglyceride. Less than 150 mg/dl. Desirable. 150 to 199 mg/dl. High level at the border. 200 to 499 mg/dl. High. 500 mg/dl and above. Very high. Take note. It is almost impossible to reach normal LDL levels, especially for people at high risk, without taking cholesterol-lowering medications. Many doctors will start suggesting statins when total cholesterol reaches about 108 mg per deciliter or higher, cholesterol level 6, for countries where measurements are moles/L instead of mg/dl. Part 6. Natural treatments for high blood cholesterol. 1. Eliminate carbohydrates. Total intake of starchy foods and carbohydrates is associated with metabolic syndrome, a condition defined by high cholesterol and other factors that equate to a higher risk of heart disease. The Mediterranean diet features plenty of cholesterol-lowering foods, and also includes low amounts of refined carbohydrates and healthy fats. The large amount of healthy fats in the Mediterranean diet can also help raise good cholesterol, HDL. It is also a natural treatment for high blood cholesterol. 2. Lose weight. Losing just 5 to 10% of your total body weight helps reduce triglycerides and increase HDL levels. This type of small, but significant, weight loss usually doesn't affect your LDL cholesterol numbers, but it can improve your overall cholesterol levels. It is a natural treatment for high blood cholesterol. 3. Stop smoking. Smoking worsens many aspects of health, and cholesterol is just one of them. This practice tends to lower your high-density lipoprotein, HDL, levels while raising your bad LDL cholesterol, making it an unacceptable risk if you're at risk for heart disease. It is a natural treatment for high blood cholesterol. 4. Move. A sedentary lifestyle means there is no risk of heart disease. However, performing moderate-intensity resistance exercises or high-intensity aerobic exercise increases your HDL levels. Exercise often helps support weight loss or maintenance, which is another reason it's a good habit to get into while protecting your heart. It is also a natural treatment for high blood cholesterol. 5. Cholesterol-lowering nutritional supplements. There are a number of supplements that may help you achieve normal cholesterol levels, but keep in mind that your healthcare professionals should always be aware of the supplements you are taking in addition to medications. If you take cholesterol-lowering medication, you could experience an unhealthy, severe drop in your cholesterol if you don't monitor it closely with the help of your healthcare professional. Examples of this are niacin. While you should get enough niacin, vitamin B3, through a healthy diet, it's abundant in beef liver, chicken breast, tuna, sunflower seeds, and grass-fed beef. You can also choose to use it in supplement form. Niacin is often prescribed along with statin medications. Large studies have indicated that time-release niacin helps reduce LDL levels, raise HDL levels, reduce triglycerides, and even reduce VLDL particles by up to 68%. There is also this wonderful, important product that is a source of vitamin B3 in the description box. Red yeast rice. Another controversial supplement, red yeast rice, works like statins but without many of the unwanted side effects. In a 2015 research study, red yeast rice prevented weight gain and improved overall hyperlipidemia, meaning it lowered total cholesterol and possibly elevated LDL levels. Citrus bergamot. Studies show that the antioxidant polyphenols in citrus bergamot support not only healthy cholesterol levels, but also a healthy HDL cholesterol to triglyceride ratio. 6. Take cholesterol-lowering medications. While conventional medicine considers this a first-line effort, cholesterol-lowering medications are sometimes necessary to treat very high cholesterol. In the case of familial hypercholesterolemia, a genetic defect that means the body is unable to remove LDL cholesterol from the bloodstream, a person is more likely to develop heart disease and is unable to lower cholesterol levels without medication. Cholesterol-lowering medications include statins. It works to reduce harmful LDL cholesterol levels and moderately improve triglyceride and HDL cholesterol levels. Niacin. Approved in high doses as a prescription drug, niacin lowers LDL and raises HDL cholesterol. Bile acid resin. These medications work inside the intestine, attaching to bile and preventing it from being absorbed into the blood. Fibers. Fibrates, such as fenofibrate, limit triglyceride production, increase HDL cholesterol in some cases, and may reduce VLDL levels. They are usually prescribed with statins. PCSK9 inhibitors. PCSK9 inhibitors are a new class of cholesterol medications, usually prescribed only to those with familial hypercholesterolemia. They help your body remove LDL more efficiently by blocking the action of the PCSK9 protein. Part 7. And the important thing. But it is the most important. Everything you learned in this video is wonderful and useful, but you must definitely always discuss changes to your medications or supplement regimen with your healthcare professional, and do not change without their supervision. Here's my final thought. Cholesterol is an important substance. It is used in many bodily processes. Eating foods high in cholesterol does not affect blood cholesterol numbers significantly. Instead of worrying about individual LDL or HDL numbers, keep your HDL, LDL ratio at 1 minute and 2.5 seconds or less. If you need to achieve normal cholesterol levels, there are 7 main ways we mentioned previously to raise your HDL cholesterol and or lower your LDL cholesterol, including reducing your carbohydrate intake, losing weight, moving more, and trying some supplements. You can find their links in the description box. If you are interested in this kind of healthy content and healthy nutrition, subscribe to the channel and activate the bell button. May you stay well and in good health.